guys, Dr. Joe Brown. So this is part three of the series that we started here. I originally had a nice lady, Mary. She sent me an email. She had a bunch of different questions that she kind of asked me in a bullet format, and I've had kind of some of these same questions from a lot of different people that were called into the office or emailed us. And so part three of this video, I really want to focus on, her question was, is it appropriate or am I able to have my primary care doctor, my conventional doctor, can I also do naturopathic treatments with Dr. Brown or a naturopathic doctor and combine those two therapies? And so the answer is yes, and why wouldn't you? So when you go to your conventional doctor, like we talked about in part two of this series, is that your conventional doctor is most likely not going to be recommending anybody other than themselves because they're on your insurance plan. But yes, there are naturopathic doctors in every state that you can go to, and depending on kind of what you're looking for, you can contact that naturopathic doctor or contact myself. I'm happy to help you. And we can go forward and take in terms of either creating a diagnosis if you don't have one yet, or if you've already got the diagnosis and you've already started some of the blood work and scans from your conventional doctor, we can actually, you can bring that blood work and those scans or biopsy reports into us, and we can actually take a look at that and assess the situation of what have you done, what needs to get done, and what treatments can we offer you from an alternative or a naturopathic approach. Now, what happens once in a while is that even in my office, that I have people that come in and they say, I went to my oncologist, I went to my dermatologist, I went to my primary care doctor, and they said, I don't need to do naturopathic treatments, or they've actually been told, I do not want you going in over and seeing such and such doctor or doing alternative treatments. That bothers me a little bit when I have doctors who tell patients this, because like I told you earlier, and I've mentioned in many videos, that a lot of my friends or colleagues are surgeons, are oncologists, are primary care doctors, are gynecologists or dermatologists or whatever. And so I have a lot of friends in the regular medical community. What happens is that you have certain graduates out of regular medical school who have taken zero education or zero classes in any kind of nutritional or homeopathy or acupuncture type of class of any kind, IB class or anything else, and they are telling their patients, don't go and do this, but yet they've actually taken 0 hours of any of those subjects other than what disease do you have and what drug to give. So the answer is can I see a naturopathic doctor? Of course, and to be honest, it would behoove you to do so, okay? And so my philosophy is always be honest with everybody that you're seeing or treating with. So if you have a certain condition and your primary care doctor says, I don't want you to do whatever treatment or alternative treatment, ask them why. And if they don't give you a good explanation or they can't explain it, go to another doctor. Because ultimately, it is not about Dr. Joe Brown, and it is not about your primary care doctor. It's about you. It's about getting you healthy. And so if Dr. Brown and this doctor and that doctor, if we're not all working in conjunction to get you better and to make you feel right and to get you healthy, all three of us or all four of us, all the doctors involved are all essentially making a bad decision. Our job is to make the patient get better. That's our ultimate job. So if you have anybody who is telling you don't do alternative or naturopathic medicine, that would be just as stupid as me telling you don't go and take drugs or don't go and do this if that's what medically you need to do. There's a time and place for both. And usually you can do a combination. I'd say 99% of the time you can do a combination of both sides of medicine and you will get better and feel better much quicker than if you only do this or you only do that. So the bottom line answer is yes, you can combine the two different types of therapies, conventional and naturopathic. Yes, you can see your conventional doctor, whether that be in a clinic or a hospital, and you can also come to a naturopathic doctor's office. And so if you want to do that, and again, this is what I did when I was diagnosed with cancer 17 years ago, is that I was very happy with my primary care doctors and my surgeons and my oncologists. I had no issues with them other than waiting in the waiting room for 5 hours at a time and seeing them for 2 minutes. But I was missing a huge part of my therapy by only seeing these guys. And that is why I searched out alternative medicine and naturopathic therapy. So I did it, and I'm recommending it for you to do it. And quite frankly, it'd be foolish not to do it, because there are things that they offer that is much quicker and easier to get done, and there are things that we offer that is much quicker and easier to get done, and quite frankly, they don't offer. So the bottom goal is to get you, the patient, healthy. It's not about my ego or not about their ego. It's about getting you well. So again, if you are interested in either asking questions or coming in as a patient, you can always go to my website, which is drjoebrown.com. You can click on this area right here where it says contact us. And let me just scroll down here for a second. You can see our 2 direct phone numbers are right there. There are 4 green bullet points of things that I'm going to ask that you bring in. If you've had your initial biopsy report, you've had blood work done, you've had scans done, make sure you get paper copies of all that stuff for me before you even call or even email me, because that's what I'm going to ask you to do. If you don't have that done or you only have portions of that done, it's not a big deal. We can do that for you. We do blood work here in the office. We can send you off for scans, or I can set you up with one of my medical doctors who are my colleagues and friends, and we can get that done through your insurance. So either way, that's not a problem. But again, I hope that answers the question. I'm Dr. Joe Brown, and again, happy to help you. Thank you.